Thank you for joining us today. Today's health briefing is the first in a series of bi-weekly briefings focused on presenting real-time COVID-19 healthcare data specific to vulnerable and at-risk populations in South Central Pennsylvania communities, inclusive of York, Lebanon, Lancaster, Hanover, and Gettysburg. This briefing is presented by FamilyFirst Health, a leading regional healthcare organization serving at-risk populations for the past 50 years. FamilyFirst Health is a federally qualified healthcare center serving more than 20,000 patients annually. We invite the media and the public to submit questions in the comment section of this video post or in advance of our briefings by emailing healthbriefings@familyfirsthealth.org. Copies of the video briefing will be made available online at familyfirsthealth.org shortly after each briefing. We will begin momentarily.
Thank you for joining us today. As a community healthcare provider dedicated to providing quality, accessible healthcare to the vulnerable and underserved and at-risk populations across our region, we welcome you to this conversation. Today's conversation is as relevant now as ever. We are about to discuss the circumstances of COVID-19 and how they have amplified the disparities in access to care, and we know that healthcare is an essential part of the Black Lives Matter movement. We cannot speak to the injustices in access to care without addressing the related social determinants of health and the systematic issues that challenge our communities on an ongoing basis. Today, we launched the first of our bi-weekly health briefings to inform the public of the realities of caring for those in need during this health crisis. While we serve the South Central Pennsylvania region, we are not unlike many other communities across the country, faced with a virus that is having a disproportionate impact on vulnerable and at-risk and minority communities. Our goal is to inform you of real-time data as we compile reports of the care we offer to our patients in our local community so that we may work collaboratively to achieve improved access to healthcare delivery and overall wellness. For the past 50 years, FamilyFirst Health has led the way in designing healthcare for the changing needs of our region. In 2019 alone, we provided free confidential HIV testing to over 900 individuals, connected over 300 first-time moms with registered nurses for regular home visits during their pregnancy and early childhood stages, kept 60% of our substance use treatment services patients engaged in care and on the road to recovery, and provided over 4,000 children with comprehensive dental services in their school or early learning environments as part of our mobile dental program. By elevating, understanding, and giving a voice to those most impacted by COVID-19, we hope to create an opportunity to bring those challenges that we have long known, how social determinants of health are weighing heavily on our patients' abilities to be healthy every day. The fractures that exist for some in the healthcare delivery system have become cavernous for many. We have long understood the places we live, work, and play impact a wide range of health risks and outcomes. Specifically, as it relates to COVID-19, density in housing, essential work in high-contact workplaces, and lack of access to high-quality food are just a few of the factors that increase many of our patients' risk for contracting and transmitting the virus within vulnerable populations and communities. Every other week, our team of expert medical professionals who all work on the front lines will share newly published data from our healthcare teams, while also presenting pertinent information, to help us progress how we care for the changing face of our region during this crisis and beyond. Data will also be compiled from our newly launched locations offering testing and are designed to fill gaps in accessible care for non-English speaking patients and high-risk populations. For today's health briefing, I'm joined by Dr. Patel, and I want to be, there she is. I'm glad to have her join me today. Our agenda today, we'll cover a comprehensive data that we're reporting publicly for the first time regarding how COVID-19 has impacted our patient population, what healthcare precautions should be taken into consideration as we reopen into the green phase or multiple phases of reopening in our communities. And lastly, we'll end with some personal insight from the perspective of our patients and providers. As a reminder, please submit your questions in the comments section, and our producer will grab those and make those accessible during our question and answer time. And at this time, I'd like to introduce formally Dr. Patel, a FamilyFirst Health medical provider, and who's not only an expert in the field of family medicine, but also holds a master's degree in public health. Welcome, Dr. Patel, and I'm going to turn it over to you.
Thank you, Jenny. So I work as a physician, as Jenny said, to our FamilyFirst Health team, and I also have had training in public health. Allowing both of these degrees, I work with vulnerable population, and today I will be reporting on data that FamilyFirst Health has compiled since the beginning of the COVID-19 pandemic. The data is specific to our region that we have compiled, and as a purpose of presenting this data is to highlight and reinforce the disparities that we are seeing. We also want to share and reinforce some important safety and health information to the audience. I work in the front lines, and so the trends so far that we have discovered are very concerning. These trends deserve a greater attention and consideration in our discussion as we talk about how to safely reopen our economy in our region. The points that we want to share before we discuss the data in our community that is necessary is that we don't have necessary testing and contact tracing to fully understand the impact of COVID-19 cases in our community and our region. To reduce the risk to others and to mitigate that risk and to safely reopen, we have to give greater attention to these disparities. The community requires a greater investment into accessible testing and adequate contact tracing. We are lacking the standard protocols to mitigate the risk and reduce the risk of infection to others. So exactly how can I explain that to you? I'm going to give you an example. So if a patient is positive for COVID-19, we do not have adequate supporting infrastructure to safely ensure that every patient that is positive for COVID-19 has a safe place to isolate and quarantine so that they can reduce their risk to others. Another example I have is in terms of as we're seeing fewer cases in our region and we're headed in the right direction in the pandemic, we want to make sure that there's adequate contact tracing. So do we have enough trained personnel who can reach out to those folks and help them and identify if they've been exposed and help them isolate so we can reduce the risk further to the other members in the community? These are important issues that we need to address and essential factors that should be part of our discussion as we think about how to cautiously and safely reopen our community and get our economy back running up. Now let's come to the data that FFH has compiled and plans to report on an ongoing basis. Our data highlights the focus on vulnerable and at-risk population that are affected by COVID-19. The first slide here is an example of the patient population that FamilyFirst Health serves. We have three graphic representations here. The first graph that you're seeing is the patients that we serve by their insurance status. So as you can see, we serve 61% of Medicaid population and 11% of patients we serve are uninsured. 10% are about Medicare and 18% of the patients we serve actually have commercial insurance. The second graphic representation in the middle that we're looking at is representation of our patients by their race or ethnic identification. And as you can see, 54% of the patients we serve are white or Caucasian. About 19% of the patients that we serve are Hispanic or Latinos. Black or African American members are about 14%. And then we have non-reported 11% by race, and then other categories of patients that we serve by 2%. And then the third representation on this slide is our patients by their income status. So we do serve the underserved and at-risk population. So as you will see, we're presenting the data here by the federal poverty level for a family size of 4. So 48% of the patients that we serve are below the 100% federal poverty level. And then about 17% are between the 100 to 150%. And then the other 7% are 151 to 200%, and 7% more are above 200%. So now we will go to slide 2, which are the data that we've discovered as we were putting it together. Okay, we have our slide 2. So this is our FamilyFirst Health data of our patients who have been tested in the region. And, there is a lot of information here, but I would like to start with a bigger picture. So I work in one of our sites in York County. We serve more than 3 counties in the York region, but the positive test rate, so of those individuals who were tested and positive, 6.24% are positive in York County. As we compare that to our internal data at FamilyFirst Health, our positivity rate is 18.88% or almost 19%. This is a striking difference. This is alerting to me. So as you can tell that our patients at FamilyFirst Health are more likely to contract COVID-19 and be infected and get sick. So the second portion of the data that I would like to highlight for the audience is that total patients that we serve at FamilyFirst Health is greater than 25,000. About 789 of our patients have been tested, and to date we have had 149 patients test positive for the COVID-19. We have some selected information that we will share from the data that we have collected. So as you can see in the circular graphic representation as the first part of the graph is by language. So of those patients who were tested and tested positive, our Spanish-speaking patients, 69% of those who were positive spoke Spanish, and about 30% speak English as their primary language. In the middle graph, it's the data by ethnicity. So as you can see, that the Hispanic and the Latino population is 81% of those who tested positive. That's 81% of the population. I will take a pause here so that we can understand how big of a disparity this is. Many of you may have heard the national numbers in the communities of color, how disproportionately African American are impacted. In our local data in the community that we serve, we are seeing that 19% of the patient we serve are Hispanic or Latino, but 81% of our patients who tested positive are Hispanic or Latinos. This is a grave disparity that needs to be focused on. People need to be discussing this. And then, we have to think about how do we mitigate risk for this population. But let's review a little bit more of the data. So the non-Hispanic Latino population that tested positive is about 16%. And then for not reported, it's about 3%. And then coming back to the third representation of the income status. So of those who tested positive, below the 100% poverty level that we mentioned earlier, it's about 89% of those who tested positive are below the 100% poverty level. So looking at the folks who were above the poverty level, that's about 11%. Now, for those of you who don't look at numbers every day, this is a lot. So we have a very simplified representation to show you in our next slide. Just give us 1 second and we'll have the slide up for you. So there it is. So this makes it a little bit simpler, right? There's more words and the numbers are bigger. So just to summarize for you what we learned in the previous slide, when your ethnicity is Hispanic or Latino in our region, the likelihood chance that if you are tested, that you will test positive for COVID-19 is 5 times as more likely. So this risk is 5-fold higher because you're Hispanic or Latino population in our region. And if we sort of try to look at the data through the lens of the language, your primary language that you're comfortable in, and if you identify as Spanish as your primary language, that also is about averaging 5 times your risk for having a test that would be positive. So this is telling us that in the patient population that we serve, most, if not all of them, are vulnerable and at-risk population, but the population that and community that is of color is disproportionately affected when we are looking at our regional data, at our county data, and they are affected more and at a higher rate. So is your ethnic or racial identity what makes you more likely to get a test? No, to have a positive test. Not necessarily. It's not your race that's putting you at risk, but it's the other factors that come with this race, with this population that are making them have a positive test. So the at-risk population, as Jenny mentioned earlier, they might be residing in a high housing density area. Their employer might be one that allows them to have a high contact with the rest of the population. Many of them work essential jobs where they might not be able to work remotely and they come into contact with other folks, putting them at a higher risk for being positive. And then I do also want to emphasize that many of our patients live in areas of food insecurity where they do not have access to quality, high nutritious foods, which also puts their immune system at a higher risk of contracting the virus and delays their recovery from this illness that they get. Jenny, I'm going to come back to you and then we can come back to a patient story.
Great. Thank you so much, Dr. Patel. And thank you for reinforcing that while we highlight these disparities by race and ethnicity, that all of our risk is determined in great part by our behaviors and where we live, work, and play. And you emphasize those points expertly for us. At this time, we're going to take some questions and we'll get started with those. I think they're going to come up on the screen for us. So what work is being done that you know of to improve testing and contact tracing? So Dr. Patel referenced the importance of adequate access to testing and also contact tracing. So that contact tracing it means that when a person has tested positive, that there is an effort made to think about the places they've been, the people they may have come in contact with, and then inform those individuals that they may be at risk and so offer testing to those individuals. There's been some controversy about contact tracing, but we know in every public health situation or outbreak or pandemic, the contact tracing is just essential to controlling and mitigating the impacts of the situation. In the state of Pennsylvania, we do have a public health approach that offers some access to contact tracing. Here in the city of York, we're lucky to have a localized health bureau that can focus on this work in the city. In the counties that we serve, there is less ability to manage in a pandemic like this contact tracing. The state is developing plans to bolster contact tracing. And as an individual primary care provider, While we do not do contact tracing, we've integrated COVID testing into our primary care services so that we can help patients sort out their risk of exposure, their symptoms, and work on work on offering testing to those individuals who may be at risk, and to provide lots of education so those individuals themselves can go home and understand how to protect their families, understand how to inform their employers, and work to mitigate the risk of the virus. So more to be done in this area, but certainly a lot that we can take on as a family practice provider, and we're doing everything we can in that area.
Jenny, I would just like to add that it is not easy being an average member of the community when you get an illness like COVID and then you do not know, but random folks are calling you. So I have been thrilled with our work with our guided care coordination. Most patients, if English is not your first language, it is hard to understand when people call and ask you many questions. And our guided care coordinators have been reaching out to our patients who are tested positive or negative, but especially the ones who result positive, helping them understand that what they need to do to be safe and to expect a call from their local public health authority, and help understand why that is important, and encouraging them to talk to them so that our local public health authorities are able to identify those patients and try and help contain the virus.
Thanks for highlighting the great work of our guided care coordinators and community health workers that have just been integral to helping our patients navigate through this situation. We'll go to a next question. So aside from washing hands, social distancing, wearing masks, what as a community can we do to prevent a resurgence of COVID-19? I have one thing that comes to mind for me, Dr. Patel, and then I'll certainly welcome your thoughts. I think it's more important than ever that we as a community support one another in these precautions to prevent and mitigate the spread of COVID-19. So as we think about the protection for essential workers, as we think about how we interact in new ways with service providers, how we navigate our lives, so to be patient, not frustrated, to comply with the requests of businesses that we're working with, and to really lead by example, that doing those things that are very effective, that are referenced in the question, and doing them openly and publicly so that this becomes the norm. This needs to become part of our culture in the way that we interact with each other until we have an immunization or a vaccine. And so these things are difficult, and many are anxious to get back to their normal lives. But we will be working to mitigate the effects of COVID-19 for some time. So I would really encourage you to advocate for essential workers and to think about your own behaviors as you navigate through the reopening of our communities. Dr. Patel, anything else on that front?
Sure, Jenny. So this is a wonderful question, but I do want to emphasize what an important message this question is asking. So I want to urge and encourage every single member of our community to be washing hands, following social distancing, and wearing a face covering when we're in public places or within 6 feet of some other individual. And what else can we do? There's a lot more that we can do to help understand our risk and a risk to our community. So as you mentioned, there are businesses that are opening up as our community reopens, but being patient and then making sure that we are giving everyone adequate space and time. So I want to encourage everyone that if you're feeling sick, you should not be going out into the community. We have a greater risk of resurgence as we get closer to fall, and that's what everybody talks about. But if you are sick, then you can spread to other people. So if you can stay home, you're gonna not spread that illness, may it be COVID or something else, to the rest of our community member. We need a healthy population to be able to fight when they get the COVID infection. And then I would just really want to urge that if you have somebody sick in your family, that get them tested. And please, you also need to isolate because you've been in close contact. You become a vital part of that contact tracing. So we urge you to talk to your primary care provider and get what is necessary to be excused from your work if you have a sick individual that you're caring for at home. I think that also will help to mitigate the risk to the rest of our community members.
Thank you, Dr. Patel. Let's go to the next question that's somewhat related. And this is an individual wondering if FamilyFirst Health is concerned about the recent spike in COVID-19 cases in Lebanon, 97. She's reporting that 97 have been added to the total count in just the last week. I'd say first that we expect some increase in cases as communities reopen. But as Dr. Patel just articulated, we are concerned across communities, not necessarily specific to Lebanon, although we have appreciated being able to offer testing in Lebanon to connect with the community for both primary care and testing. And we want to be a source for people to help have their concerns answered and identify their risks and be tested if that's what's needed. But we expect this increase. What we hope is that we can all work together to mitigate an overwhelmingly negative effect of a natural increase as we reopen. Dr. Patel, would you add anything?
No, absolutely, Jenny. As more people are getting outside, as more businesses are opening up, this is the trend that we're going to see. And we want to, as you said, immediately contact trace, make testing available, and get that spike under control as soon as we can. But this is expected.
Next, we have someone asking, what are some things that vulnerable populations can do to protect themselves and their families? And I'll ask you to respond to this, Dr. Patel. I first and foremost come to workplace exposures and thinking about how to navigate that. That's been particularly difficult for our patient population, and one that we have already referenced some of the things that we've done to support, but really want to continue to advocate for safe conditions for all of our patients in their workplaces as one primary thing that individuals can do. But Dr. Patel, I'll defer to you.
So as Jenny, you said, and I have noted in my practice that many of my patients work in the essential workforce and come in contact with everyone. So I just really encourage them to go to work, but be safe around others. So as I come to work, when I am surrounded by people, I have to wear a mask. We wear gloves, encouraging hand washing. As soon as you get home, if you're, able to shower and change your clothes, all of those things are going to mitigate your risk. And then be cautious when you go out into the community. It is very exciting to know that we're reopening, but not all of us should be out all at once, because that's going to be putting everyone at risk. So being judicious about how you're going outdoors, what activities we're engaging in, and who we're engaging in, that will reduce the risk. But yes, just taking and following the basic steps, and then encouraging, if you're at all feeling sick, please do not report to work, report to your healthcare provider. And if you do not have a healthcare provider, feel free to reach out. There are many organizations taking patients, including ours, that we will be more than happy to see you as a new patient.
So Dr. Patel, a follow-up question: as we go to green in York County and some other surrounding counties in South Central Pennsylvania tomorrow, is it still important to wear a mask? I think we've said this, but it won't hurt to say it again.
Sure, and I can say it as many times as needed. It is absolutely necessary. Wearing a facial covering or a mask has proven that we can definitely decrease the rate of transmission. And when we know that something works, we want to use it. So honestly, everyone in the media is talking about a corona vaccine. When we have the vaccine, we want people to use it because it works. Same way, wearing a facial covering works to protect you and to protect people close to you. So I urge every single patient, even though it is uncomfortable and we're getting into the warmer weather, that we need to be wearing a mask at all times when you are outside close to others.
Thank you, Dr. Patel. We have a question about ways that contact tracing might be improved, and I think we've referenced the bolstering that's needed for contact tracing, so just more timely contact tracing. But what I would say, what I would emphasize in relation to something that Dr. Patel shared, is the need for that contact tracing to be culturally sensitive, to be able to be delivered in the language that the person prefers, and to really be delivered in a way that instills trust with the individual. And that's why I know there's many efforts at the state level to think about expanding the types of people who are doing contact tracing and the types of connections that are made. It's something that we are not accustomed to, and can leave people a bit unsure, but it's a critical part to mitigating the spread of the virus as we move forward. And so if we think about those cultural and language aspects, those come to mind for me as ways that we can improve, along with just ensuring there's adequate, timely contact tracing available.
So Jenny, I will just add, when you talk about adequate contact tracing, it really is so intertwined with testing that if we get a test, if patient is able to get a test done and get a result quickly, in the 24 hours instead of 4 days, then that really will help us reduce the risk to others. The patient will be able to better remember who they've come into contact with, and then if they need to be tested. So I just think that adequate testing sites and adequate testing supplies, a timely return of the result that allows, and as you said, in a language that you feel comfortable and in a non-threatening way, if the patient is encouraged to share information, that then allows us to have action or inform others who might be at risk. That's what adequate testing is. Pennsylvania is a state that has a very interesting public health structure compared to what I learned when I went to school. And so we have county, state health centers, city health departments. They're all governed slightly differently. So we do not have a one standard protocol, a one standard set of questions that we're asking. So I think that as more resources at a state level are put into this and that are culturally sensitive and language friendly, I think that we will see better results from our contact tracing.
Agreed. Thank you. I would also emphasize, and this relates to several of the questions that we talked about. You saw the data that we presented today was broken down by race, ethnicity, and language. And so often that does not occur when we're looking at health-related data. And I would just want to start to wrap up our conversation by emphasizing how important it is to be looking at data by race, ethnicity, and language so that we can determine those disparities. By doing work like that and allowing us to look across populations that are impacted by COVID and any other health condition by race, ethnicity, and language, it allows those disparities to be highlighted and should prompt us to take action. Most recently, we've all been challenged by understanding that we continue to live in a society and a community where there are inequities in many ways. And they manifest themselves differently for different folks on a daily basis. Many of those circumstances can cause people and have caused people for a long time to feel vulnerable. I think this pandemic has touched all of us and increased our own vulnerabilities. And so one of the maybe hopefully lessons learned is the empathy that can be developed as we've all experienced vulnerabilities as we've worked through this. It's why ensuring that adequate care is available and is designed to meet people's needs has been part of FamilyFirst Health's mission for 50 years, and why we continue that mission today at this point in time, and particularly want to lift up the voice of our patients during this pandemic and beyond. So I want to ask Dr. Patel, as we again move towards closing out our time today, to share some of her more personal experiences delivering care during this very unusual time to be a primary care provider, and some of the impact that she's seen on her patient population.
Sure, Jenny. So a couple of examples come to mind. I know that across all of our regions that we serve, we have not seen infrastructure available to isolate patients who do not have it. So a couple weeks ago, I took care of a patient who was a migrant worker, and the living situation did not allow him to safely isolate when he was determined to be COVID positive. And through our local York support and program, we were able to help him isolate through a hotel program. And that allowed that patient not to transmit the virus to the others that he lived with. And he was very thankful. This patient did not have a PCP, is only in the country certain months of the year. But for us to be able to offer him care services, had a lot of anxiety around what this looks like after having COVID to go back to home. What is his risk to his family in Mexico? And he was just thankful that without having to come into our office via telehealth, that we were able to serve and answer questions in a language that he felt comfortable in. Another example that comes to mind is my patients who are positive, and they're, when I talk to them, what stands out for a patient that I touched base with last week for a hospital follow-up is this patient's question was, why did I get the coronavirus? And I did not have a answer that made him feel comfortable. This patient works at a grocery store, is extremely cautious, had a facial covering every day that he went to work. He used gloves. As part of his family, he has wife and 2 kids, but he got sick about 6 to 8 weeks into the pandemic, right? He had been going to work every single day for 2 months. And when he got sick, he wasn't feeling well, so ended up going to the hospital. He got tested for COVID. He turned out to be positive. And even though he was completely healthy, sorry, one second. He was healthy. He did not have any underlying comorbid conditions or any illnesses that would put him at a higher risk. He got very sick from the COVID. He needed to be put on high flow oxygen, and then he needed to be transferred into the ICU. In the ICU, he needed to be put on a ventilator for days. His family was extremely scared, but with God's grace and the medical treatment, the patient did improve. He was able to come off of the ventilator and also got put back on oxygen. And prior to being discharged home, he was taken off of oxygen. He is recovering well, no longer having any fevers. He has finished his quarantine period. But as I was in conversation with him, he kept asking me, I am worried. I'm going to go back to work. The work I do is essential, but I'm worried for my wife. I'm worried for my children. And so I want to salute him for going back to work. We need our essential workers to do the work that they do so that we can get our groceries or our healthcare or be safe in other ways and be served when it's necessary. But I feel that not only medically treating him and testing him, but to help him with his worry that every member of our community needs to make sure that we are doing what we can to keep everyone safe. And this comes back to that public health message that we have emphasized so many times in this short segment to say, please wear your facial covering when you're out in the public. Please wash your hands. And when able, absolutely social distancing is necessary to mitigate the risk, to keep our loved ones safe, to keep our essential workers safe, and to keep our community safe. We need to be cautious and be patient as we reopen our community.
Thank you for reemphasizing those important messages, Dr. Patel, and sharing your perspective. I think that in future health briefings, community health briefings, we will be diving into more closely the issues that directly impact our Latino community. We'll also be looking at the reopening of dental care and how at FamilyFirst Health we're managing through that and things that people should be aware of along those lines. And then it occurs to me as you're talking about essential workers, both of the stories that you shared had to do with our access to food in some way, whether that's the harvesting of food or availability in a grocery store. And that particular industry is one that we might want to have some conversations about how to advocate for and protect as we continue to move through the coming months. And we do move into our harvest seasons in our agricultural areas around South Central Pennsylvania and the communities that we serve. So those are some of the topics that we'll be bringing to you over the coming weeks. We look forward to continuing the conversation. Thank you, Dr. Patel, for being part of the conversation today and sharing all the valuable information that you have, and you share that with us every day. So I'm glad to share out more broadly in the community. As we close, I want to thank everyone that joined us as well. We'll post this briefings and copies of the data to our website shortly following this broadcast. We'll have our next health briefing on Thursday, June 25th at 9 a.m. and please follow our social media channels for latest updates. Thank you very much and have a wonderful day.